Today I want to talk about myocarditis and pericarditis following COVID vaccination, and also we're going to see some data regarding the number of cases after COVID infection. There has been a lot of debate, as you know, regarding the issue of myocarditis and severe adverse events after vaccination. So I think it's really important to talk about this. Let me know if you have any questions, if you have any comments, write your comments below, and I will try to answer as many of them as possible. What is pericarditis? It is a swelling and irritation of the thin membrane that surrounds the heart. And as you can see on this picture, on the left side, you have a normal membrane that surrounds the heart with no pericarditis. On the right side, you can see the membrane is swollen and you have this red line around it, which shows swelling and irritation of the heart. The chest pain occurs when the irritated layers rub against each other. Okay, so that's what gives pain, which can be very sharp. And sometimes pericarditis goes away without treatment, but sometimes it requires treatment. It can be much more severe. It can cause even death in some cases. Myocarditis is an inflammation of the heart muscle. The inflammation can reduce the heart's ability to pump and cause rapid or irregular heart rhythms. Oftentimes, myocarditis can be caused by a viral infection, and it can also be due to a reaction to a drug. This is taken from the Mayo Clinic's website, mayoclinic.org. What are the symptoms of myocarditis? It includes chest pain, fatigue, shortness of breath, and rapid or irregular heartbeats. This paper was published in 2021 in Nature Medicine, which is a very well-known, well-regarded scientific journal. These people are from well-known, respected institutions. This is a British study from researchers from Oxford, from Leicester, Edinburgh, Nottingham, and they use the English National Immunization NIMS database for COVID-19 vaccination. One of the main results of this paper is an increased risk of arrhythmia, which is irregular heartbeat, following a second dose of mRNA 1273, which is the Moderna vaccine. Subgroup analysis by age showed the increased risk of myocarditis associated with the two mRNA vaccines, the Pfizer and the Moderna vaccines, was present only in those younger than 40 years old. So in yellow here, I highlighted some of the most important information and results of the paper. So in this study, there were 1,615 and 1,574 admissions or deaths related to myocarditis and pericarditis, and a lot of cardiac arrhythmias. This is, however, for a very large group of individuals which were vaccinated, 38 million, a bit more than 38 million, okay, almost 39 million actually. And the number that were admitted to hospital or died from myocarditis and pericarditis, which is roughly the same number actually, represents roughly 0.04%. That may sound very small, but let's look at the natural occurrence of myocarditis in the population in normal times, okay, at baseline times, baseline periods outside of the COVID period, for example. And these numbers are usually not very much. It's typically 1 to 10 per million, according to several studies, and I show you a reference here. And this number here is actually a lot more. It is 40 per million. So that's quite a bit more. So now let's see what they found. As you see here, they write that following a second dose of the Moderna vaccine, the increased risk of myocarditis was much higher compared to the other vaccines. And they also write that the risk of myocarditis increased in the first 28 days following a COVID positive test. Okay? And the incidence rate ratio is roughly the same. As you can see, it's actually a little bit lower, but I would say it's roughly the same number following the Moderna vaccine or following COVID infection. For pericarditis, we have roughly the same amount, and the percentage is the same as myocarditis. And here we have, in this figure, the number of excess events in the first 28 days post-vaccination or post-COVID infection, or actually, I should say, post-positive test for COVID, which is not exactly the same as infection because the infection has occurred before the test was done. But here, really, what you see are all the different vaccines after the first and second dose, and also here after a positive COVID test. What you see are the excess events, and you can see that there are excess myocarditis events in people aged less than 40 years old for the Pfizer vaccine after the first and second dose, and especially for the Moderna. Here you can see this huge increase, very high increase after the first dose and especially after the second dose of the Moderna vaccine. So if you are less than 40 years old and you get the Moderna vaccine, your chances of myocarditis are much increased. In fact, they are higher after the second dose compared to even COVID infection. So that's one of the main results here, which is very important. And because here I'm talking about the vaccines, we want to be sure that the vaccines are safe, and we're talking about adverse events of the vaccine. I'm not disputing the fact that COVID infection also does produce unwanted severe, which can lead to myocarditis. But they do find in these studies that the vaccine does produce an excess event of myocarditis in the less than 40 years old, which is much higher than that of COVID infection. Let me know if you have any questions, if you have any comments, write your comments below and I will try to answer as many of them as possible. Thanks a lot again, and I'll see you in the next video.